Welcome back to the Dr. K call. Today we're going to talk about sports injuries. I want to dedicate this to Gale Sayers, who recently passed away this past week. One of the greatest running backs in the NFL, held 6 NFL records. I think he still holds 3. One of the greatest running backs and also a friend who passed away. A great loss to everybody across the country because he was a very soft-spoken, well-known, and great example of a man. He was a great, great running back. So, as you've heard in the NFL over the last week, there's a number of injuries, and these are sports injuries that occur all the way from Little League, soccer, to high school sports, all the way to college, and then universities, and into the NFL. So I'm going to talk a little bit about the injuries and anatomy so that you get an idea of what happens when you have a knee injury. So here's a model of a knee. And so this is the front of the knee, and this is the back of the knee. So that bone you feel in front is your kneecap, your patella, and that's this bone. And it articulates with the femur, which is the thigh bone, and then this is the tibia, which is your shin bone. Now, if we were to remove that muscle and look at this, you can see when you fall and you twist, many times you have an injury, okay? And this is your meniscus, or the cartilage that is torn by athletes. And you don't see that on an x-ray. When you take an x-ray, you see the femur bone and the tibia bone, and you see a space in between. When there's no space is when you need a joint replacement, but most of us still hopefully have some space. And then there's these 2 ligaments called the cruciate ligaments. One is in the front and one is in the back. Therefore, anterior cruciate and posterior cruciate, and cross like this. That's why they're called cruciate ligaments. And then on the inside, you have a medial collateral ligament, which is on this side. This is the inside. And on the outside, you have a lateral collateral ligament, and this is on the outside. So your knee is very complex. There's a lot of leverage on this joint. As you can imagine, when you're running, it not only flexes and extends, but it also rotates a bit. So that's where we get into trouble. These washer-like pads give your knee stability, and they also pad it. So when you lose part of your meniscus, that is not good. God gave you those for a reason. But if it's torn, many times it does not heal. The blood supply for the meniscus comes from the outside third. So the outside third of these can heal, but most of the times the tears are a lot bigger than just the outside third. So when you have an injury and you get seen on the field or on the basketball court or on the soccer field, generally what we do is examine it. If it's really swollen, it's probably full of blood. We want to make sure you don't have a break, so you get an x-ray. If there's a fracture of these surfaces, that's a problem. Most of the time it's a tibia that gets fractured, but sometimes you can get a fracture through, especially if you're young, through the growth plates, and that's a serious injury. Many of those require surgery. Hopefully most of the time it's just a sprain. So ice, elevation, wrapping it, and taking it easy, giving it some time to heal, maybe some anti-inflammatories can help get things under control. A little therapy is always very helpful. And then if it's a more serious injury, then you end up having an MRI after the x-ray, and the MRI will show us these menisci, or these cartilage, and the ACL or the PCL. The ACL is commonly reconstructed. Sometimes you use part of the patella, the patellar tendon. Sometimes you use a graft. Sometimes you use hamstrings that come around this side, and you harvest the hamstrings from the patient, or you can actually use cadaver hamstrings. So there's many ways to repair the ligaments. In the end, most of the time, a simple arthroscopy, tiny little incisions, outpatient can take care of any meniscal problems, can take care of your ACL problems, and the reconstruction and the rehab is a big deal. So Going forward, remember all these things come back to haunt you as you age, and many of those then end up with arthritic changes. And that's what happens with many of our NFL players as they age. They have many problems with their joints, as did Gale. And so that's why I'm dedicating this to Gale Sayers. Gale Sayers, number 40, Chicago Bears, greatest running back of all time. Rest in peace.